Snoring and sleep apnea are common ailments millions of people suffer from each night. While snoring can be loud and disruptive to loved ones, it is important to remember that it may signal a life-threatening disorder such as sleep apnea. Both snoring and sleep apnea prevent you from getting the sleep you need to be energetic, productive, and an overall happy person. It is extremely important to distinguish between snoring and sleep apnea, as their treatment plan and level of urgency are quite different. While the majority of people snore at some point in their lives, it is typically more of a social problem than a serious health issue. Snoring can be either intermittent or habitual, and while it is often a problem for a bed partner, it is not life-threatening. On the other hand, chronic snoring can be a sign of sleep apnea and will require a visit to your local ENT clinic. You should contact your local ENT clinic if you suffer from chronic snoring, as it may be a sign of sleep apnea, and it could possibly mean decreased levels of oxygen during sleep and decreased REM sleep. Lack of sleep and oxygen can result in mood swings, poor concentration and energy, and a higher risk of developing cardiac and pulmonary disease. If you do not seek treatment, you may also be at an elevated risk of strokes, heart attacks, and cardiac rhythm abnormalities. It is important to note that only a physician can determine whether or not you're suffering from sleep apnea. Common signs and symptoms of sleep apnea can include snoring with pauses in breathing, excessive daytime drowsiness, gasping or choking during sleep, restless sleep, problem with mental function, poor judgment, memory loss, quick to anger, high blood pressure. Fortunately, there are many treatment options available for those suffering from sleep apnea. Non-medical treatments that may be recommended include weight loss. As little as 10 pounds may make a difference. Change of sleep position. Avoiding alcohol, caffeine, and heavy meals. Avoid sedatives. Additional treatment options may be available and recommended through your ENT doctor. Radiofrequency and laser-assisted uvuloplasty are two common methods used to treat sleep apnea specifically. If you're suffering from severe snoring or sleep apnea, it's important to seek medical advice as soon as possible. For those located in the Texas DFW region, the team at Central Park ENT is your partner in snoring and sleep apnea treatment. With 3 locations in Arlington, Dallas, and Fort Worth, we are one of the leading ENT clinics in Texas. To learn more about Central Park ENT and to book an appointment, please visit us online at www.centralparkent.net.